you asked about a difficult question on the impact on the U.S. fundings, etc. Well, first of all, I want to say, also on a personal note, of course, that we hope that this is still being reviewed and reconsidered, because I think that the statement from the WHO has been clear, regrets that announcement of the intention to withdraw from the organization. And we need a strong World Health Organization, which plays a crucial role while protecting the health security of the world people, including Americans, addressing the root causes of disease, but also building stronger health systems, detecting, preventing, and responding to health emergencies, including disease outbreaks, often in dangerous places where others cannot go. And therefore, we really hope for this reconsideration and look forward to engaging in this constructive dialogue at all levels, which we always did. And like I worked with the US all the time in when I was 7.5 years rep in Afghanistan, and now. And I even want to make this even a bit personal. Like I've been I'm a medical doctor, but I also graduated from Johns Hopkins School of Public Health. And the US has an array of really strong public health schools: Hopkins, Harvard, Emory, Berkeley, Tulane, you name it. But also we worked, of course, when I worked in the field, Africa and Asia, here, a lot with CDC, very strong National Institutes of Health, etc. And that should be part of that. If you talk global health, and you talk global health security, we should focus on collaboration and not on isolation. And we need everyone on board, and specifically the US. So I really hope that somehow will be reconsidered. You ask on the direct impacts, like in OPG, we have an array of partners and donors, fortunately, with a group of 30 partners. But I quickly looked up what it would mean for example, for the occupied Palestinian territory and Lebanon. And then the US in that accounts to almost 30%, like with 67 million there of emergency, when we look at emergency operations. So that is substantial and massive. And that's just now. We are now still in the humanitarian phase, but we are already starting early recovery, rehabilitation, and reconstruction. Wherefore, much more is needed for health overall. And I think hopefully we get the figures later in the coming weeks from the UN and World Bank and the UN to really get a better overview of what is needed. So we need everyone on board. On your last questions, I find it very difficult to address and give an answer, and I think my colleague already did that.